I want to start today's episode with a situation a lot of families quietly find themselves in. A daughter is trying to help her mother manage her healthcare. Her mom has multiple appointments, medications, and specialists. There are referrals to social services. Someone mentioned Meals on Wheels. Another person suggested transportation services. A doctor mentioned a case manager. And suddenly the daughter realizes something important. There are a lot of people involved in her mother's care, but no one person connecting all the pieces. Healthcare is happening in one place, social services somewhere else, community resources somewhere else. And for families navigating aging parents, the system can feel incredibly fragmented. That's exactly why programs like Enhanced Care Management under California's CalAIM initiative were created. Because healthcare outcomes aren't just about medical treatment, they're about whether someone has access to food, transportation, safe housing, and coordinated care. Today's episode is part of a special series exploring the PACE model and the broader ecosystem of programs helping older adults remain living safely in their communities. I'm Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area. As someone in the sandwich generation myself, I know how overwhelming it can be to juggle work, parenting, and aging parents, often while trying to make important decisions inside systems that don't always explain themselves clearly. That's exactly why I created the Simplify Senior Transitions podcast. This show brings together professionals across the senior care ecosystem, from healthcare leaders and care managers to senior living experts and community organizations, so families and professionals alike can better understand how the different parts of the system fit together. Today's guest is Harmony Young, the Enhanced Care Program Manager at OnLock. OnLock is widely known for pioneering the PACE model, which provides comprehensive medical and social services that allow frail, older adults to remain living at home rather than moving into nursing facilities. But in addition to PACE, organizations like OnLock are also expanding their services through programs connected to California's CalAIM initiative, including enhanced care management and medically tailored meal programs. Harmony oversees the ECM program, which focuses on helping individuals who are at risk of institutional care access the resources they need to remain safely in the community. Today, we're going to talk about how enhanced care management works, what CalAIM is trying to accomplish, and how programs like these are helping coordinate care in ways families often don't see. And most importantly, how all of this fits into the larger ecosystem of supporting people as they age. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
And we are back. Harmony, welcome to the show today. How are you?
I'm doing well, thank you.
So, Harmony, before we talk about the ECM program, I'd love to start with your personal story. What originally brought you into this work?
Well, I actually did not think that I would be into healthcare, but I somehow found a job at OnLock. And I started off as a clinic receptionist, which is basically helping our participants, we call them, make appointments to see their doctors. And as I, grew in my role,
Yeah.
I realized that I really do enjoy helping this population. So throughout my career here, I've had a lot of different opportunities to work directly with older adults and seniors. And I just found that I really enjoy, listening to their stories, hearing about what they need, learning ways I can help. And I've been here ever since.
Yeah, that's really interesting. I always find that people who work in senior care often have a very personal reason that draws them into this field. Now, you've been with OnLock for quite a long time. Can you share your journey with the organization?
Yes, so I've been with OnLock for 17 years now. It's just as I said earlier, I started off as a clinic receptionist. Throughout my career, I have held different roles. After the receptionist role, I've been an admin assistant, I've been a supervisor, I've been a manager, I've been a director. And I just found that throughout these different roles, I've connected myself more and more to our mission, which is to, allow people to stay at home independently as long as possible. So that's really what I hold near and dear to my heart. So that's why I'm still here now, and I had the opportunity to learn more about the initiative and
Yeah.
also been has a care management program.
Now, how did those early experiences shape how you think about caring for seniors and vulnerable populations today?
So I learned that we all age, right?
Right.
And as we age, we might need different levels of care as we age. So, again, throughout my career, I've all the roles I've been in, I've had the chance to work with this population directly in their various stages and kind of see how they age in place.
Right.
And that has really given me a lot of experience to understand what this population needs.
Yeah. Now, some of our listeners and viewers may not be so familiar with CalAIM, so let's talk a little bit more about that. So, when people hear the term CalAIM, it can sound very policy heavy. At a simple level, what is CalAIM trying to accomplish?
So, CalAIM, I'll just start with a little bit of context. It
Yeah.
does stand for California Advancing and Innovating Medi-Cal. So,
Yeah.
Medi-Cal is actually the California version of Medicaid, right? So, what this program does is it tries to integrate medical services with social services. So, what CalAIM does is it takes a whole person approach, meaning care that integrates both medical needs and
Yeah.
social factors.
Okay. Got it. Now, what problem in the healthcare system was CalAIM designed to address?
So, a lot of people in the community, they struggle with having access to housing, food, transportation. So, CalAIM really looks at the whole person, not
Right.
just our medical needs. They're looking at all these social factors that make up the person to help them stay healthy and safe in the community.
You know, that's such an important point because people assume that the healthcare system is already coordinated when in reality it often isn't. Now, why is reducing hospitalizations and emergency room visits such an important goal?
Because it kinda tells us that we're managing our members, we call them, maintaining their health. So, it kinda allows us to help them manage their care earlier and more
Okay.
consistently, because if somebody is always going in and out of the hospital or emergency room, that's very emotionally and physically stressful
Right.
for our members. So, by working with them earlier to help them maintain their health,
Mhm.
then we would be able to achieve this goal of reducing hospitalizations and ED visits to help improve the quality of life and really help our members sustain living at home.
Okay. I have a follow-up question to that. How does CalAIM recognize that health outcomes are influenced by more than just medical care?
So, CalAIM is not just about the medical piece. CalAIM is recognizing that health doesn't just come from the doctor's office.
Yeah.
As I mentioned, it's really about what's happening in someone's daily life, things that
Okay.
are impacting their day to day,
Yeah.
such as having resources to stable housing, food and nutrition, transportation to medical appointments. So, what ECM does is help bridge together all these different services.
Okay. Okay. Now, for listeners who may not be familiar with the term, what exactly is enhanced care management, ECM?
So ECM is a program that allows our members to live independently at home. Our mission is very similar to the PACE program, right?
Yeah.
Letting seniors or older adults live at home. What our program does is provide you with a lead care manager that helps you coordinate your services and the resources that you need to live independently.
So I have a question then. So does everybody that's connected to Unlock, do they have access to the enhanced care management program? Or how does that work? Because I know that Unlock has so many sites around the Bay Area.
Right. So right now, this ECM program is serving members who are signed up with San Francisco Health Plan
Okay.
as their medical insurance.
Okay. So does that mean that only folks that are connected to Unlock, for example, the sites that are in San Francisco, can can enroll in this program. Is that correct?
So the folks that are outside of San Francisco, they're currently with our PACE program.
Got it.
So, they would need to change their primary insurance to be in the ECM program.
Okay, I understand. Now, in general, who typically qualifies for ECM services?
So, as I mentioned, we're working right now with San Francisco Health Plan. So, right now we're serving those members. The population that we're working with is people who are age 21 and over at
Okay.
risk of long term care institutionalization, meaning they are at risk of being placed in either a long term facility or a nursing home, for example.
Okay. Now that's helpful because I didn't realize it could go down to age 21. I imagine many people don't realize they might qualify for programs like this.
That's correct.
Now, what types of challenges are the individuals in the program usually facing?
So the challenges could be either medical or non-medical. So,
Okay.
a lot of people on the medical side, they might not have access to a doctor or they don't know where to
Okay.
find a doctor. They might be facing social factors such as, social isolation,
Yeah.
some behavioral health challenges, lack of access to food and transportation or in-home support services. I mean, we had a couple of members who had not seen a doctor for several years.
Okay.
And through our program, we were able to get them connected and then find that transportation to bring them to the doctor's appointments. We even help accompany our members to doctor's appointments. Sometimes we're really there to help our members, break down those barriers.
You guys offer quite a good amount of support, and I love that. Now, what does the role of a lead care manager look like day to day?
So our lead care manager really meets our members where they're at. We
Mhm.
have a big focus on outreach. So we're going out in the community a lot, trying to meet them where they're comfortable meeting us. It doesn't have to be in their home. If they're not comfortable with us going into the home, we might meet them at a nearby coffee shop or a cafe or at their doctor's office. It's wherever our members feel most comfortable.
Okay. And how hands-on is the support your team provides to members?
Oh, I'll say we're very hands-on because
Mhm.
we are willing to meet you where you're at. And we usually, like I said, we go to the doctor's appointments with you and we would even get on the phone with you if you need to. If you need us to help you call Social Security, we'll do that. We help you, fill out applications, fill out forms for services. We really try to be somebody that you can trust and
Yeah.
rely on to get those services.
Yeah, that level of involvement can make a huge difference for people who are struggling just to navigate the system on their own, you know? What are some of the most common barriers your team helps people overcome?
I would say access to transportation, access to food, and stable housing. So a lot
Okay.
of times we have folks that say that their neighborhood is not safe and they ask us to help them look for other places where, their living environment might be a little bit more safer. And a lot of folks might say, "Oh, I need more help at home, cleaning, cooking," then we would help them apply for in-home support services.
I know Unlock is best known for the PACE model, but now you're operating programs like ECM under CalAIM. How do those programs complement each other?
So our mission is very aligned, meaning we want our members and our participants to remain independent at home as long as possible.
Mhm.
So we support individuals who might not yet qualify for PACE, but we
Oh,
provide services to them to kind of stabilize them in the community. And then once we feel they might need a higher level of care, then we would refer them to our PACE program.
okay. It's almost like a pre-PACE program then. It seems like just to be a feeder program into it. Is that fair to say?
Yes, the difference I would say is ECM, you have a care coordinator connecting you to all those different services,
Oh,
where in PACE, you have a whole team of people
yeah.
connecting you to the care.
Okay, I got it. I mean, it's also fair to say that these programs create a kind of continuum of care.
Yes, yes, that's correct. Because ECM does support individuals when they do have complex healthcare needs, and we help them navigate the system with finding resources. But if somebody needs a higher level of medical care, let's say, then we would refer them to our PACE program, where there's more comprehensive medical support.
Yeah. So again, I'm just trying to get more clarity on that. When does someone transition fully from ECM into PACE?
So if somebody needs more medical services or their care is getting heavier,
Yeah.
then we would refer them to our PACE program. We did have a referral recently where we felt the member needed a lot more comprehensive medical services and referral to specialty services. We went ahead and made that referral so that they would have a whole care team behind them, as opposed to just, one lead care manager connecting them to services.
Okay. Let's talk more real world examples then. I mean, can you walk us through, an example of someone your team might help?
Yes, we have somebody who had not seen a doctor for 7 years. She's fairly on the younger side in her 30s. Unfortunately, she had an accident, and since then she became nonverbal and she didn't really leave the house. And her mother really needed help, caring for her daughter, given her mother herself was on the elderly side. So we received this referral and got her enrolled, found her a doctor, started accompanying her to medical appointments, and she is doing much better today. And her mother is actually enrolled in our PACE program and
Yeah.
also receiving services. So it really brought peace of mind to the mother. And, now the daughter is getting care and the family is being well cared for by on lockdown.
Yeah. In a scenario where someone is struggling with housing, transportation, or healthcare coordination, what does the care manager actually do step by step in a situation like that?
Yeah, so our care manager meets our members where they're at to understand what their goals are and what their priorities are. So they would work together to create a plan of care.
Yeah.
And then from that plan, they would tackle each goal one by one to get them connected to the services that our member feels is most important to them at the moment.
Okay.
And we would frequently check in on our members just to make sure they are receiving the support that they need. And if there's
Mhm.
anything else we can do to make sure that we're supporting their independence and health.
Got it. Now, I know another part of CalAIM many people don't know about is medically tailored meals. I know it's probably a new term for my listeners and viewers, but what does that program look like?
So medically tailored meals is also another program that's being offered to our partnership with San Francisco Health Plan. So
Okay.
that is a program that helps our members support their health through managing, their chronic conditions through meals. We do send out 2 meals per day for a total of
Mhm.
14 meals per week. Those meals are hot meals for lunch and then a frozen meal for the dinner. So our members can heat that up on their own. And we also have a registered dietitian
Okay.
who provides 4 sessions of nutrition counseling for members to talk to them about what diet or what recommendations they have to keep them healthy.
Speaking of nutrition, how can nutrition impact health outcomes for someone managing chronic illness?
So our medically tailored meals connects our clients with healthy food that helps them
Mhm.
manage their health through improved nutrition, right?
Mhm.
We might be able to help them improve or manage their chronic illness, such as diabetes or hypertension or heart disease. So, if somebody has access to the right foods, then
Yeah.
that will naturally improve their health and any other health complications that they might be facing.
Yeah.
And we do have the 4 sessions offered by a registered dietitian. Through that education, the member can understand what foods are healthy for them and help them maintain that healthier lifestyle.
Do you find that many families simply don't know programs like ECM exist? How are you guys getting the word out?
I would think a lot of families might be surprised to learn that there's programs like ECM
Yeah.
and they might have heard about it, but they don't know how to access it. That's why I feel awareness and outreach are very important to
Yeah.
programs like ours. So I would encourage people who are interested and would like to learn more, to just go ahead and contact us directly to find out more information.
Okay, yeah, I imagine that lack of awareness is one of the biggest challenges. I mean, I wouldn't have known it even myself unless I knew someone had unlocked, like yourself telling me about it. Now, if there's one thing you hope families and professionals understand about enhanced care management, what would it be?
I would say enhanced care management is about meeting people where they're at and helping them navigate community resources. And we are here to provide support to people to stay healthy, stay independent, and get them connected to the services that they need.
Okay, noted. And lastly, any final words and how can someone learn more about enhanced care management if they wanted to?
So, my last words are, I would encourage people to contact us if they want to
Yeah.
learn more, because it's really essential for people to get connected to the resources that are available in the community that they might not know about. So, the best way to do that is to give us a call or visit our website.
Okay. And I'll go ahead and have all of Unlock's contact information in the show notes for everyone. So, Harmony, thank you for sharing your perspective today. Programs like enhanced care management don't always get a lot of public attention, but they play an incredibly important role in helping people maintain independence and supported in their communities. And for families navigating aging parent decisions, simply knowing these kinds of programs exist make a huge difference. If you found this episode helpful, please consider leaving a 5-star review on Apple Podcasts or Spotify. It helps more families discover the show. If you're a family navigating a senior transition right now, you can learn more about resources and guidance at www.simplifyseniortransitions.com/families. And if you're a professional working in senior care, healthcare, or housing who wants to collaborate or connect, visit www.simplifyseniortransitions.com/professionals. Harmony, thank you for being on the show with me again today.
Thank you.
You're welcome. And for everyone else, I'll see you on the next episode of the Simplify Senior Transitions podcast.